All right, guys, it's Zach with HIDEF Physical Therapy. I want to talk a little bit today about what we call envelope of function. So basically, there's a principle called envelope of function, which determines basically whether you're going to get stronger or whether you're going to get better or not. And how that works is you've got this graph over here. One side is load, the other side is frequency. So as you see, as the load increases and the frequency increases, you have to do less to get benefit. And that makes sense, right? The more you're in the gym, the more load you're using, the less you have to do it. The lighter the load, the more often you have to do it. But there's this area right here in the middle that we call supraphysiological overload, the zone of supraphysiological overload. And basically, that's the area that we want to work in. And so while we have you in physical therapy, we're trying to work you somewhere in that area. If we push you too much, you get to the zone of structural failure. So that's basically where you got injured in the first place. We're trying not to take you there. Sometimes we take you right next to that line during our PT treatment. That's why you get sore maybe for 24, 48 hours after in that painful area. But our goal is not to get you up here because that's where structural failure happens and that's where you get re-injured. So we're trying to work you into the zone. Now, the problem with most rehab is that it functions down in that zone, the zone of homeostasis. So that basically means you're doing enough to maintain, but you're not doing enough to actually see a gain. So once you've gotten injured and we're trying to get a gain in strength, we're trying to get a gain in range of motion, if you don't push the body enough, what happens is you just stay in the zone of homeostasis and you don't ever get better. Okay, and then the worst area to be in is that little zone down there. That's actually the zone of subphysiological overload. So that's like if you were on bed rest or if you were unable to do anything, maybe you were splinted, you were in a cast or you're in a walking brace, you're not able to do enough. So you're actually now losing, right? So you're losing muscle mass, you're losing range of motion. And that happens a lot of times after surgery. And so what we want to do is, and you've seen some of our videos, we want to get you up and moving as fast as possible, but we also want to train you as much as possible in areas that are not injured, right? So if you injure your ankle, that's one of the reasons why we want you to come in and work your hips, work your core, and even keep on lifting upper body, because we don't want you to get into that subphysiological underload where you actually start to make that loss. So again, just to reiterate, when we're in PT, we have to hit this zone of overload. So that's why at HIDEF we use a lot of tools like kettlebells and weights and not just resistance bands and body weight, because eventually that load is not high enough. And if you're not doing it enough times a week, so let's say you're only doing a moderate load one time a week, you're gonna land here and you're never gonna get stronger and you're never gonna get better. So that's why, a lot of times we prescribe 2 to 3 times per week frequency or 4 times per week frequency so that we get the frequency higher. And then with the injury, you don't have to take the load as high because you've got this kind of line that curves down. So the more times you're in the gym, like we said, the more times you're doing your PT exercise program, the less we actually have to load you. But nonetheless, we still have to create that load to get the benefit of improvement, and that is what we're focused on at HIDEF.